We stand in strong affirmation of the resolution that the United States federal government should pass Medicare for all. The current healthcare system in the United States is failing millions of people, creating unnecessary financial burdens, and leaving access to care unequal. Our plan provides a clear and effective solution. At the end of the day, healthcare is essential, and when people cannot access it, the consequences affect individuals, families, and society as a whole. Contention 1, harms. First, the current system creates serious harm for American citizens. Healthcare in the United States is extremely expensive and tied to employment, meaning that if someone loses their job, they also lose access to healthcare. This creates instability and forces people to delay or avoid medical treatment. Even for those with insurance, high deductibles, co-pays, and limited coverage make care unaffordable. People are forced to choose between paying for health care and meeting basic needs like rent or food. Evidence: Slug, Medicare for All lowers uninsured rates. Citation: Congressional Budget Office 2020. Quote, under a single-payer system, nearly all residents would have health insurance coverage, substantially reducing the number of uninsured individuals. This shows that millions of people currently lack insurance, and without coverage, they delay care and suffer worse outcomes. Evidence: Slug, Medicare for All improves access. Citation: American Hospital Association 2019. Quote, Medicare for All proposals would expand coverage and increase the number of individuals receiving health care services. This proves that even when care exists, people cannot always afford to use it, which limits access across the country. Because of these issues, the system prioritizes profit over people, and millions suffer both financially and physically. Contention 2, inherency, why it won't fix itself. These problems will not solve themselves under the current system. Private insurance companies are built on profit incentives, meaning they benefit from limiting coverage and increasing cost. Employers are not required to provide consistent health care, which makes access unstable. In addition, political gridlock has prevented meaningful reform. Evidence: Slug, Medicare for All simplifies healthcare billing. Citation: Economic analysis of Medicare for All. Quote, a single-payer system simplifies billing and reduces administrative complexity compared to multi-payer systems. This shows the system is overly complex and inefficient due to multiple insurers and billing systems. Evidence: Slug, Medicare for All reduces administrative costs. Citation: Congressional Budget Office 2020. Quote, administrative costs under a single-payer system would be lower than those in a multi-payer system because of simplified billing and payment structures. This proves the system wastes resources on paperwork instead of patient care. Because the system is built this way, these problems will continue without federal action. Contention 3, plan. Our plan is simple. The United States federal government should implement a Medicare for All system that provides universal health care coverage to all citizens. This ensures that access to health care is based on need, not income or employment. Funding: this plan will be funded through federal taxation, including relocating current health care spending and implementing progressive tax measures. While taxes may increase, overall health care spending for individuals will decrease because premium, deductibles, and out-of-pocket costs will be eliminated. Enforcement: the federal government will administer the program through an expanded Medicare system, ensuring that all citizens are automatically enrolled and have access to comprehensive healthcare services. Contention 4, solvency. Medicare for All directly solves the problems we identified. Evidence: Slug, Medicare for All saves lives. Citation: Galvani et al., The Lancet 2019. Quote, universal single-payer health care could save more than 68,000 lives annually in the United States. This shows the plan has real measurable impact by improving health care outcomes. Evidence: Slug, Medicare for All reduces costs and expands coverage. Citation, Booth Healthline 2020, quote, there would be virtually no out-of-pocket costs for healthcare-related expenses. This removes financial barriers and allows people to seek care when they need it. First, it guarantees universal coverage. Second, it reduces overall costs by simplifying the system. Third, it removes financial barriers to care. Finally, it creates a more equitable system where healthcare is treated as a right and not a privilege. Conclusion, for these reasons, we strongly affirm the resolution. Medicare for All is not only necessary, but it is the most effective solution to the current healthcare crisis in the United States. Thank you.